AM 1150 and 101.7 FM WDEL.
All right, let's get to Dr. Chris Casscells. Dr. Chris Casscells was a very, very well-known and respected ortho surgeon here in Delaware. And in addition to that, I want you to know this about Chris, because he's going to give you some opinions here that are counter to a lot of things that we're hearing. His epidemiology and public health training was at Yale by Dr. George Silver, head of the Yale School of Public Health. Silver, by the way, is internationally famous and renowned, okay? He was taught infectious diseases and virology by Dr. Merle Sand at the University of Virginia School of Medicine. And these courses of study are represented by his Bachelor of Science at Yale, his medical doctorate from University of Virginia. He does not have specific degrees in either infectious disease or epidemiology, rather this area of study within those Yale and University of Virginia degrees as well. So we want to make sure that not being misrepresented. With that in mind, Chris, thanks for being on.
Thanks for having me, Rick.
And by the way, I think the biggest tribute to you and your ethics is that I'm not the only one who ever saw you with a way for you to make money, but you said, no, I'm not going to cut you. Who ever heard of an orthopedic surgeon who doesn't want to cut and make more money? My gosh, what is wrong with you? All right, so I have some serious questions about this, and I've been reading opinions from a number of different physicians. Sean Green, WDEL news and sports reporter, in fact, award-winning sports reporter, was talking with and had audio from a number of experts regarding sports and high school sports here in Delaware and whether or not kids should be going back to play. I have a very specific question I want to ask you about masks and playing sports, okay? If wearing a mask while playing football can make existing heart problems and asthma worse.
Oh, absolutely it can.
It can, okay. Because I'm hearing from some... Go ahead.
The mask also can act as a rebreather, and it's the same thing we see with ventilators in the ICU. The patient can actually get sick because of how sick the ventilator is. So when you're constantly putting out moist, wet, contaminated, perhaps infected air into your mask, guess what? You're breathing it back in higher concentrations because the bacteria are multiplying in your mask.
So at Delaware Turf, the spectators have to wear masks. The kids do not wear masks while they're competing, but they do on the benches. And I want people to consider this, and I want to get your reaction to this, Dr. Casscells. The Mayo Clinic estimates 1 in 50,000 young athletes die of undiagnosed heart diseases every year. That sounds like it's rare, but let's do the math. 30 million young people play sports every year in the U.S. 30 million divided by 50,000 is 600, unless my math is wrong. So 600 kids are estimated to die this year from undiagnosed heart problems. Now, because anywhere from 1/2 to 2/3 of these kids are African American, that means 400 of them could be African American kids. Because of those kids, year after year after year, it's the African American kids who go undiagnosed, so much more so than the white kids. So far, does that actually make sense to you medically?
Yeah, there are certain subpopulations that are prone to certain problems, and it doesn't surprise me at all. There are known to be people with undiagnosed cardiac arrhythmyas and excessively large hearts. You might remember the gal who got beaten to death in the bathroom. She had an underlying cardiomyopathy. We see this all the time. Essential hypertension, which is a disease somewhat in disproportionate levels seen in young African American men, is a predisposer to many problems, including a modern form of rickets, of vitamin D deficiency, because the kidney isn't functioning well. So that's not an unusual statistic to see. But like all things epidemiological, you have to weigh the overarching benefit of athletics and competitive sports against a fairly small number of disease entities which weren't properly diagnosed or treated. I had a wonderful patient whose knees I ended up replacing. It turns out he was screened by his high school football team for being able to play football. They did urinalysis on him, and lo and behold, he had proteinuria. He had protein in his urine. Well, it was never worked up, but it turns out he was a renal transplant patient by his mid-20s.
Oh, my God.
Because he had essential hypertension, and the reason I was replacing his knees was because he had developed vitamin D deficiency rickets as a teenager because his legs didn't develop right.
So here's where I'm going with this. I actually am going somewhere with this, and it's about wearing masks while playing sports, especially football. So if the Mayo Clinic, Johns Hopkins University, they know for a fact, based upon studies and how many kids do and do not get treatment for heart conditions, they know for a fact that 1/2 to 2/3 of all the kids in this country, especially student athletes who have existing heart conditions that are undiagnosed, are African American kids, black kids. The vast majority of them are. And we also know that wearing a mask can exacerbate these conditions and make it worse. So I know this is going to be really controversial for me to say, but I got to say it because I've been thinking it. We know more black kids have heart problems than white kids. We know that forcing young athletes to wear masks while playing can cause more heart and lung problems. So if indeed more black kids are hospitalized or die, the result is racial. And thus, it seems to me, this policy of making kids wear masks while playing football could be a form of systemic racism.
Well, yeah, I mean, obviously, but let me answer you with a rhetorical question, which is the purpose of wearing a mask, of course, widely known, is to prevent the transmission of disease from the wearer of the mask to other people. So now my question to you is, why in hell's name are you putting a player who has a disease that you don't want to give to the other players on the field at all, mask or no mask? If the fundamental purpose of the mask is to not spread disease, why is that player on the field?
All right, so my question to you, Dr. Casscells, is this. What do you believe the policy of Delaware schools and athletic programs should be?
I think probably you should do a nasal swab on the kids once or twice a week and take the ones off the field of play who test positive until they're quarantined for 2 weeks.
Let's get to something else, and this has been on my mind for quite a few weeks. Why are there thousands and thousands more cases of COVID? We know that it is highly contagious, but so few hospitalizations.
That's very simple. We are doing thousands and thousands more tests, and the tests are many hundreds of times more accurate than they were in the beginning. The truth is the fatality, the mortality of the disease peaked in the week of April 11th, and it's been essentially non-fatal, non-mortal since then. As I've explained in the past, if you take the peak, and let's take worst case scenario, that 2020 will end up with somewhere between 9 and 12% more deaths than we would normally expect in a calendar year. And you do the math out of that, and you look at who died, which is disproportionately nursing home patients and older patients with comorbidities. What that translates to, in a way that people can understand, is that on average, across the board numbers in Delaware, slightly less than in the United States, but on average, the people who died lived 1 month shorter than they would have normally lived.
How can anyone measure that? How can you actually measure that?
Well, basically, you do the math. How many more people died in the year, and you spread that over the 12 months of the year, and what you find
based upon their age. So that's based upon their age and underlying diseases that they already had?
Yeah, that's the net effect on longevity of life collectively. The people could have lived a month longer minus COVID on average. Now, this is across the board. There are going to be exceptions. And in many cases, I'm sure that the death is perceived by the family and the individual as untimely. But in many cases, including my mother, father, and brother, had they died a month earlier, that would have been a blessing. So I don't know where that stands. I'm not being a moralist here. I'm being an epidemiologist. And that's you have to, when you look at, death is not the only point to global health. There are other factors that go into epidemiology other than death as endpoint. But we really, I mean, to think about the Spanish flu of 1918 was that it disproportionately wiped out young people. And that was a tragic effect on our demographics and our workforce for many decades thereafter. This is not going to have that demographic effect. It simply isn't. The worst thing you can say about the COVID-19 is that it probably is going to have some small effect of lowering the untimely drain of Medicare funds.
All right, let me ask you this question, too, because we only have about 2.5 minutes left. There are some sports physicians around the country suggesting that COVID is causing heart problems, enlarged hearts, weakened muscles. What do you say to that?
I say we don't have the answer yet. There are reports I'm looking at that says that there is if the COVID-19 virus gets into the brain, it replicates very easily with very little natural defense against its replication. We do know that when you put somebody on a ventilator, you tend to precipitate more basement membrane disease and multi-system organ failure of the kidney and other organs that have basement membranes beyond just the lungs. So ventilators are a red flag. We're learning a lot with this virus. It is highly contagious, but it's also not very fatal to the vast.
And what you're learning is that the ventilators themselves are causing so many health problems that physicians and respiratory therapists are trying to avoid putting people on ventilators, right?
We're trying very, very hard to avoid ventilators because the mortality is disproportionately associated with the use of the ventilator. They do better off the ventilator.
If Governor Carney were to ask you, Dr. Casscells, what do you think I should do regarding schools, what would you say?
I would say that not opening the schools back up and relying on virtual learning is a pipe dream. You have to open up the schools. It's essential to the health of the community, to the epidemiology of the community, that schools open back up. I'd say the same about the vast majority of businesses. For starters, I would mandate across the board that anybody who has been documented to have the disease and has been quarantined for 10 days or less, 9 days is really all that's necessary, those people should be allowed to operate freely. They are good to get into the community. They should not be locked down or anything like that. They should be out there. They should be promoting herd immunity. I think it is unhealthy to lock down Delaware any further, and I don't see a plethora of insignificant testing being the basis for decisions. I think we're in this political silly season, and some bad decisions are being made.
Well, Dr. Chris Casscells, thank you so much for your time. Appreciate that, sir. An opposing point of view for reopening Delaware.
Appreciate it, Rick.
Yeah, and a well-educated one as well. We'll be back right after this.